Good afternoon, everybody, and welcome to this Facebook Live. My name is Valentina, and I am a member of the public relations team here at Moffitt Cancer Center. Thanks so much for joining us for a special Insurance Open Enrollment Facebook Live for patients. When it comes to your health, having the right insurance coverage for you and your family is important. With Medicare Advantage Open Enrollment now underway through March 31st, this is a great time to review your current plan and make sure you have the right coverage moving forward. Today, we have two Moffitt experts from the Financial Clearance Unit to answer all of your questions and share the latest updates for this upcoming open enrollment season. Joining me are Javier Gonzalez, Financial Clearance Unit Supervisor, as well as Danielle Rodriguez, Manager of the Financial Clearance Unit. Thank you so much for being here today. Before we dive into our discussion, here are a few quick reminders for our audience. Please submit your questions in the comment section below this video, and we'll do our best to answer them live. Also, please keep in mind that we cannot provide personal medical advice or make diagnoses via Facebook. Everything you post is on a public forum, so any comments or questions will be visible to the public. So with all that being said, we'll start with the first question. And let's start with the basics. What is Medicare Advantage open enrollment season, and when does it end?
Thanks so much, Valentina. I'll take that first question. Medicare Advantage open enrollment is a set period for each year when people who already have a Medicare Advantage plan can make changes to their coverage. During this time, you may be able to switch to a different Medicare Advantage plan or return to traditional Medicare depending on your situation. The open enrollment period ends March 31st of 2026.
Thank you for explaining that, Danny. One of the questions we've been hearing most for patients relates to Humana. Why will Moffitt no longer be in network with the plan starting July 1st, 2026? And what does this mean for patients?
Thank you, Valentina. Insurance companies and healthcare providers regularly review and renegotiate contracts. In the case with Humana, they've made a business decision that affects this network starting July 1st, 2026. This change does not reflect the quality of care at Moffitt. For patients, this may mean Moffitt is considered out of network for certain Humana Medicare plans, which could affect coverage or costs depending on the plan.
Thank you for clarifying that, Javier. And on the same subject of Humana, some patients received a letter stating Humana will provide continuity of care through December 29th of this year, 2026. What does that mean, and what happens on December 30th and 31st?
Continuity of care allows patients who are already receiving treatment to continue seeing their current providers for a limited time, even if the provider is no longer in network. This helps avoid interruptions in care. So we encourage patients to contact their insurance directly on continuity of care eligibility and criteria. After a continuity of care period, in this case, after December 30th, Moffitt will be still out of network, and there may be additional requirements and authorizations needed to continue care at Moffitt.
Thank you, Danny. And staying on the topic of current plans, we've also had questions from patients who may have already made changes. So what if a patient already changed their Medicare Advantage plan for 2026?
If you've already changed your plan for 2026, there's still time to do so during the Medicare Advantage open enrollment period that ends on March 31st. And if you happen to make a plan change during that open enrollment period, the new plan will go into effect on April 1st.
Thank you, Javier. And just a reminder to please submit your questions in the comment section below this video, and we'll do our best to answer them live. We have some questions about patients who are still deciding what to do. So will I be able to use my Humana plan at Moffitt in 2026 if I decide not to make a plan change?
This is a great question, and the answer depends on the plan, the type of Humana plan that patients have. Humana Medicare PPO plans provide coverage at out-of-network providers. Patients enrolled in PPO plans are not required to obtain special exceptions to receive care from out-of-network providers and facilities. However, depending on your specific plan benefits, this may result in higher copays and greater out-of-pocket expenses. So after July 1st, 2026, patients with Humana Medicare HMO may require additional approval from Humana to continue at Moffitt. We encourage our patients with Humana to contact Humana directly to determine how this change will affect their ability to access Moffitt after the network change.
Thank you, Danny. We have another question around referrals. In this case, the patient stating that Humana is suggesting they go to other providers. Can they still refer patients to Moffitt?
So, with insurance companies, they may encourage patients to see in-network providers, but referral rules will really depend on the plan. Some plans still allow referrals to out-of-network providers. Best thing for patients is they should confirm referral and coverage rules directly with their insurance provider.
Thank you for answering that, Javier. And then more broadly, some patients have noticed changes across several Medicare Advantage plans. The question reads, we've seen that some major Medicare Advantage plans are leaving Moffitt out of their network. How can Moffitt patients with Medicare Advantage still access the cancer center?
Patients may be able to access Moffitt through their out-of-network benefits, continuity of care approvals. They may explore switching plans if that's an option for them, or returning to traditional Medicare.
Thank you for clarifying that, Danny. For those patients reviewing their coverage right now, choosing the right plan can feel overwhelming. What factors do you recommend should people consider when choosing a Medicare health insurance plan?
So, I would say important factors to consider would include monthly premiums, deductibles, maximum out-of-pocket costs, provider networks, prescription coverage, referral requirements, and lastly, coverage for specialty care such as cancer treatment.
Thank you for answering that, Javier. One term people often hear when talking about insurance is balance billing. What is balance bill, and will Moffitt balance bill patients who receive care out of network?
That's a great question. A balance bill is when a patient is billed for the difference between what the insurance pays and what a provider charges. No, we do not balance bill patients for out-of-network services. Moffitt bills patients according to the insurance plan benefits after a claim is settled with the insurance company.
Thank you, Danny. This question is about asking the right questions. So when a patient calls their insurance providers, what important questions should someone ask them?
Patients may want to ask if their provider is in network, what out-of-pocket costs to expect, whether referrals or authorizations are going to be required, and how the coverage is going to work if treatment is already underway.
Thank you, Javier. Some patients are also wondering about their options within Medicare itself. Can patients switch back to traditional Medicare?
That's a great question. In some situations, yes. Certain enrollment periods allow individuals to return to traditional Medicare. The Medicare Advantage open enrollment period allows for changes back to traditional Medicare. However, patients may not have a guaranteed right to purchase a Medigap policy. If CMS grants a special enrollment period, patients may be able to purchase a Medigap plan.
And you may have answered this question a little bit, but on the other side of that, what are some of the reasons someone might decide not to switch back to traditional Medicare?
In that scenario, patients may prefer Medicare Advantage plans because they may offer additional benefits or lower premiums to the patient. Others value the flexibility of traditional Medicare since you're not restricted by insurance networks. The best choice, honestly, will depend on the individual's needs.
Thank you, Javier. Another reminder to please submit your questions in the comment section below this video, and we'll do our best to answer them live. We have another question about the special open enrollment period for CMS. How can someone request one?
A special enrollment period can be requested directly through Medicare, so contacting CMS at 1-800-Medicare. This special enrollment period allows for certain changes to coverage outside of normal windows due to qualifying life events.
Thank you, Danny, for answering that question. Another term people may hear during their enrollment process is guaranteed use issue rights. What are guaranteed issue rights?
With guaranteed issue rights, it will allow people to enroll in certain insurance plans without being denied due to health conditions. These rights apply in specific situations and timeframes, like the initial Medicare enrollment period once a recipient becomes eligible, and special enrollment periods granted by CMS.
Thank you for answering that, Javier. Now we have a question for patients considering supplemental coverage. What services or benefits might Medigap cover that are not included in Medicare?
Medigap plans may help cover costs such as deductibles, copayments, and coinsurance that aren't fully covered by traditional Medicare.
Thank you, Danny. For patients who are currently going through cancer treatment, insurance decisions can feel even more complex. For cancer patients specifically, what should they understand about how health insurance and cancer care work together?
So, with cancer care, it often involves ongoing treatment and multiple providers. Understanding network coverage, authorizations, out-of-pocket limits, and continuity of care options can help avoid unexpected disruptions or costs for the patient.
Thank you, Javier. Another practical question we hear often is about finding in-network providers. How can patients determine which healthcare providers are in-network or out of network? Does Moffitt have a list of network providers available online?
That's an excellent question. The most reliable way to confirm network status is contacting the insurance directly. Insurance websites often have find a doctor feature on their website, which helps the patient locate a doctor that's in network and will show if a patient is out of network as well as contacting the insurance provider's customer service lines. Moffitt does have a list of in-network providers that or in-network insurance providers that participate with Moffitt on moffitt.org/insurance.
And for those who prefer speaking with someone directly about their options, are there resources available at Moffitt campuses for patients who have questions and want to speak with someone in person?
So the options that we have available for the patients are actually two convenient ways to contact team members within our department here in the financial clearance unit. First option is going to be our financial clearance unit hotline, and the phone number is 813-745-7300, open Monday through Friday from 8 a.m. to 6 p.m. And another option that we have as well would be by email, and that email address is going to be FCU insurance navigator at moffitt.org. And typically, with that email option, we have team members available that will reply by email and then also can reach out to you by phone to assist.
Thank you, Javier. We've also had questions from patients who may not currently have coverage. Does Moffitt treat patients who do not have insurance?
Absolutely. Moffitt treats patients with a wide range of insurance situations. We have financial counseling resources available to help patients understand options and available assistance.
And on that note, for someone who needs insurance but isn't sure where to begin, what advice will you give to help make the process of finding coverage more easy or easier?
The best advice we could give is start by learning the basics of Medicare and insurance options, and also seeking help from trusted resources such as Medicare or licensed insurance advisors.
Thank you, Javier. And we're just about out of time, but we hope this conversation has helped provide clarity for patients and families navigating Medicare and insurance options. Javier and Danielle, is there anything else you want to add before we say goodbye?
We just want to thank everyone for giving us the opportunity to speak with the community today. We know how overwhelming and confusing the insurance space can be. So we're just truly grateful to have this forum to share information and support our patients. And please know that you're not navigating this alone, and our teams are here to help.
Thank you so much to our panelists for answering these questions, and thank you to everyone for watching. For more information on health insurance open enrollment, please visit moffitt.org/insurance. Have a great rest of your day.